Question number 7, the Honourable Annette King.
Mr Speaker, my question's to the Minister of Health. What concerns, if any, has he expressed regarding the progress Health Benefits Ltd has made towards obtaining the $700 million of savings which he required them to obtain in September 2012?
Honourable Tony Ryle.
Mr Speaker, I've expressed the view to DHBs the importance of working collaboratively to harness the power of bulk purchasing and standardisation to free up resources to invest in more frontline services for patients. By way of example, by working together, the DHBs are expecting to save up to $16 million this year on banking and insurance costs and $34 million this year on regional shared service initiatives. The estimate is that by the end of this financial year, we will have saved around $300 million, which is in addition to some other DHB savings.
Supplementary question, Mr Speaker.
Supplementary question.
Is he aware that as recently as 2 months ago, HBL signalled to DHBs cost escalation and potential delays of at least 1 and up to 2 years in the implementation of his flagship finance, procurement and supply chain program? If so, what impact will this have on the $700 million saving he requires health bosses to make?
Honourable Stephen Jones. Honourable Tony Ryle.
Mr Speaker, on the finance, procurement, supply chain issue, the latest set of data that I've looked at is we're running below the budgeted cost. It's now operating on the national platform at Hutt Valley, but I've got to say that implementation is always an area of risk, and it's certainly been my message to the board of HBL to make sure that a lot of emphasis goes into the implementation, because if we are to generate the savings we need to put straight back into the health service, then implementation has to be a very strong focus.
Supplementary question,
Supplementary question, Honourable Annette.
Has he been informed that profound concern has been expressed at the mounting risk to the delivery of health services because of HBL's lack of transparent and timely information, lack of accountability for decision-making, lack of timely communication and the absence of a credible implementation plan?
Honourable Tony Ryle.
Mr Speaker, look, with change always comes worry for people because they have uncertainty about their jobs, and I'm very aware that people are worried about some of these proposals, but people need to keep their eye on the real gains here, and the gains are by working more effectively together, district health boards can make significant financial savings, and those resources can go back into supporting improved frontline services, together with the average $500 million a year extra that this government's put into the health service.
Supplementary question,
Supplementary
Mr.
question, Honourable Annette
Would
King.
he be taking action if all chief financial officers of DHBs said they had grave and collective concerns about his flagship HBL program, its cost escalations, implementation delays, benefit erosion and escalating risk profile? If not, why not?
That would be serious. Honourable Tony Ryle.
Mr Speaker, I'd be really quite keen that chief financial officers were taking an active interest in the implementation of these programs because they are, very important and very significant. And some parts of the program are moving ahead and ahead of budget, and others are going a little bit slower because of the implementation risks. Overall, we're going to be freeing up hundreds of millions of dollars over time for district health boards, all that goes into improving frontline services. And you've seen already with the insurance and the banking and other initiatives, that's money that we can save that goes into more care for patients.
Supplementary question, Mr. Speaker.
Question, Honourable Annette King.
What is the cost of funding the growing empire of HBL, which now occupies 4 floors across 2 buildings in Central Park, Auckland, while at the same time DHBs are struggling to retain staff because of the uncertainty of HBL's program, leading to significant risks in continuing current services?
Honourable Tony Ryan.
Mr Speaker, I don't think there's any risk to continuing of frontline services in our district health boards. This government's put in an average of $500 million a year extra into the health service, but it's not just about money. Those extra services are benefiting from the improved productivity that we are seeing, where we have 40,000 more New Zealanders a year getting hips, knees and other elective procedures than when that party opposite left government.
Point of order, Mr Speaker.
Point of order, Honourable Annette.
I seek leave to table a letter from all Chief Financial Officers of DHBs saying there was uncertainty leading to significant risk in continuing current services, that there is profound concern.
Order.
In fact, all the questions come from this letter.
The member will resume her feet. The document has been described. It's a letter signed by all CFOs. Leave is sought to table that document. Is there any objection? There is none. It can be tabled.
Covering up.
Order. Question number 8, Shane Arden.
Thank you, Mr Speaker. Mr Speaker, my question